some of other things, you can tell, you can see without for me, mentioning it. They are lacking, facilities for the bathing, bed sheets, and hospital equipment. And Joel says that he's been coming here for some time, and he doesn't need to go further to seek more treatment. Today I was lucky. We came here and we found a small boy, maybe about 6 years old or 7. He's vomiting and he's complaining of malaria. And are you the doctor? The father? Oh, and this is his parent. His father. He just brought him to this clinic to find out what is going on. We have visited the typical clinic here at Nakuwaddee, and I didn't want to say much when I was inside the clinic. It appears that the clinic is still lacking a lot. It lacks, the fridge is not working, and if somebody is taking the blood, taking, lab work, they don't have a place where to keep the lab work. And when I opened the fridge, I saw a lizard, but I didn't want to embarrass her while I was there. And their equipment for the lab is not sophisticated, except what I was afraid of was she prescribed the medication, and I really don't know. I have some questions about the prescription of the meds, and also the treatment of the patient in absence of the doctor, and in absence of the proper equipment and the proper handling of the whole situation. But they are doing the best they can to help the community. But unfortunately, a lot of the people, they can't come to such clinics also because of the lack of money, and also being that the proper hospitals, they are far from where they are. But at the same time too, it comes back to affordability. They can't afford, and a lot of people go out without being treated.
They have expressed interest in having a health center in the area. They have also expressed interest in having a development center in this particular place, the kind of community center where people can gather, exchange views, have planning meetings, and carry on a number of developmental activities. Another very important area they have expressed interest in to be helped is if some microfinance projects can be started so that they can borrow some monies which they can inject into small projects and then be able to pay back the money that they have borrowed. That way they will build themselves up slowly and could end up with a larger development project. I'm extremely delighted that we've had an opportunity to meet with Elizabeth and be able to exchange views. I fully support and endorse what she proposes to do. I think it will help tremendously this community that she's proposing to work in. The whole idea at the end is to empower the community. It's not to make them dependent on donations, but rather that the donations should be used to give them a starting point while they can gain the know-how, while they do develop skills that can make them survive in their own environment.
What part are you going to play in this project?
We can help to orient the people who come here, who are willing to put time into this project. Of course, even at this medical school, we do have people who come as volunteers and stay for short periods of time. some for prolonged periods extending up to 2 years. We help them to settle in, to guide them and advise them about the local environment and conditions. If the project becomes well developed, certainly the medical school would very much like to link with this project so that we together can do something that is meaningful for our communities. We do not want to remain isolated at the university, but we want to remain in touch with the local communities, work with them, and help them to address the problems that afflict them.
Most of those kids are orphans.
So I'm a freelance video producer, cameraman. I'm working for the World Food Program. My task is to shoot footage to illustrate the link between HIV, AIDS, and food, because the World Food Program is increasingly focusing on HIV, AIDS, and food, and as they say, food is the first medicine. Yeah.
This is Agnes Nyamayara, and she is an advocate of women.
Yes, I do advocate for women, but for all HIV positive people on the side of treatment, because Africa is a poor country. We can't afford the antiretroviral drugs. So I've been going out. I've been in the US twice with the Data Foundation, and we have been advocating for antiretroviral drugs for Africa. And I went last year in December, and we were asking people in the Midwest to talk to their senators, to send their messages to the senators, to their president, that people in Africa are dying of AIDS and we don't have treatment and we can't afford to buy the treatment. And this year I was there just to confirm that Africa can use the $3 billion which had been promised for next year, which the Congress sat and they said they were going to give $2 billion because they thought Africa would not take in all the $3 billion. But the problems in Africa, the problems of AIDS, orphans, TB, malaria, even the $3 billion is not enough. And we are telling people in America that if we knew if America could take the lead and give in the $3 billion, then the other European countries also